Good afternoon and welcome to this afternoon's panel. I'm Jeff Joseph, the president of SIAA. We're going to be discussing today the $7 billion health tech gamble, privacy and innovation. But first, a little bit about our organization. SIAA is a global trade association representing more than 700 companies in the global information industry. We're the only professional organization connecting financial information, education technology, specialized content and publishing, and health technology companies. Our diverse members manage the global financial markets, develop software that solves today's challenges through technology, provide critical information that helps inform global businesses, large and small, and innovate for better healthcare and personal wellness outcomes. Thank you for joining us today for this session and our discussion on the challenges facing health tech companies as they strive to responsibly innovate for health benefits on an individualized and a society-wide scale. Before we introduce our panel, I'm so excited to announce today that we are launching, SIAA is launching our Health Data Privacy Initiative led by our Public Policy Division. Working with our members, we're specifically calling for the modernization of health data privacy standards that responsibly safeguard consumer and patient privacy while promoting innovation for better healthcare outcomes. The 21st century has seen major transformations in healthcare and personal wellness, driven primarily by technology and consumer demand. Healthcare and personal wellness management are no longer centered solely around providers. Instead, consumers are and expect to be active participants in their healthcare and have access to the data driving those decisions. Technology has risen to meet those demands by providing consumers with innovative tools to capture, track, analyze, and share their personal health information. Policymakers are also paying attention. Earlier this year, HHS finalized 2 rules on interoperability that will enable patients to control their health data and that should end information blocking. But with this innovation and others, and greater access, come important policy questions. You may have heard Senator Cassidy during today's keynote, and he's right, that any policy approach must protect individual privacy while leveraging the power of big data to improve healthcare outcomes. We must address such questions as how health tech and the companies that innovate in this space can and should protect individual privacy, which laws even apply to the data, what should happen when data moves from one legal regime like HIPAA into a more softly regulated space, and how best to involve and inform healthcare consumers across that continuum. Through our Health Data Initiative, SIAA is a leading voice on these questions. We represent the interests of B2B and B2C companies that are innovating to create and expand technologies that give consumers even greater control over their own health and that generate both enhanced and value-based healthcare outcomes. Our mission is to modernize health data privacy from HIPAA to a national comprehensive privacy framework, to bridge the trust gap between health tech and healthcare providers, and promote the responsible stewardship of data. If there's anyone in the audience who's interested in learning more about this initiative, please feel free to contact me or my colleague Sarah DePaul, who's on this panel, Joseph, JJOSEPH at SIAA.net, or Sarah at SDepaul, DEPAUL at SIAA.net. And now, let's get our showcase session started. Today's session features industry experts on health data policy. We'll explore how the United States can modernize health data privacy standards to robustly protect consumers and patients while promoting continued innovation. In no particular order, let me introduce you to Jay Sultan, the VP of Healthcare Strategy at LexisNexis Risk Solutions. Jay is a thought leader in healthcare, advising over 200 payer and 50 provider organizations on new payment models, clinical data use, and interoperability. He manages the LexisNexis team that sets forth strategy and leadership for the company's healthcare solutions. Diane Sachs, who is the counsel for the Confidentiality Coalition, which is an alliance of a broad group of organizations, including hospitals, medical teaching colleges, pharmaceutical companies, medical device manufacturers, and more, and others that seek to advance effective patient confidentiality protections. Diane is an attorney with extensive experience in health regulatory and policy matters with an emphasis on health information, privacy, and security issues. Renee Quashie is the first ever VP of Policy and Regulatory Affairs for Digital Health at the Consumer Technology Association. Renee provides guidance on key technical, legal, and regulatory issues relating to consumer digital health technology products, services, software, and apps. Sarah DePaul is a member of our team at SIAA. She's an associate general counsel and our senior director for technology policy. Sarah works with our members to develop and advance global policy positions on privacy, data security, cross-border data flows, and law enforcement access. She's also the lead on our just announced Health Data Privacy Initiative. And finally, Dr. Jason Wasserman is an associate professor of foundational medical studies at Oakland University William Beaumont School of Medicine, where he also holds an appointment in pediatrics, is the course director for the Medical Humanities and Clinical Bioethics curriculum, and conducts ethics consultations for area hospitals. Jason has authored 2 books, and his current scholarly work focuses on clinical bioethics and on integrating social science into clinical medicine. So it's quite a distinguished panel. So let's open the discussion. We invited each panelist to kick us off with no more than 3 minutes of introductory remarks that must include what they see as the top 3 most critical issues regarding modernization in health privacy. So let's see, why don't we begin with the top? Let's begin with Jay. Jay?
Well, thank you. And I very much appreciate the opportunity to address this group. Here at LexisNexis, we obviously have quite a bit of data, quite a bit of healthcare data. We're one of, if not the largest holder of healthcare claims, de-identified. We have tremendous amounts of data on socioeconomics, and we have technology around cybersecurity. So the topics that are being discussed here are really important to us, because we offer the things I've described both to our end customers, payers, providers, but also to healthcare information technology vendors. So the policy side and the ethics side of what this panel is talking about is acutely important to us. In terms of what it takes to progress, I think it's important to note that we already have some level of interoperability. We've had it for decades. We just call it something else. We call it the EDI. And while the EDI certainly, or the RCM or the claims, however you want to think about it, a data stream to pay for healthcare. Where we as a country are right now is in the midst of a debate, although I think much of the debate is over. Now it's a question of figuring out how, not if. But it's a debate around how we're going to share data for the treatment of healthcare. And we're going to need to do it very differently than the way that we have interoperability around the payment of healthcare. I believe there's 3 fundamental things that we as the industry really need to solve for. The first is authorization. We have to make it easy through standardization, which is part of what the CMS and ONC rule coming out of the 21st Century Cures Act provides. We have to make it easy through standardization for patients to decide who can access their data, where their data should be sent, when it can be accessed, but also to educate patients and members and consumers about the implications and the risks of sharing their data. The second thing is we have to make significant improvements in our authentication capability. Healthcare is well behind most industries in terms of the security that our organizations use to validate and authenticate themselves, users to authenticate themselves with minimal friction. There's still far too many organizations that are using simple ID passwords that can be reset using information that's really not that hard to obtain. And then finally, it's simplification. And really so much of what I think the Cures Act and the interoperability rule is trying to address is how we get to simplification through standardization, through use of new common formats. But I think there's still problems that are unaddressed. The 2 I'll call out here are these. So my 3A, simplification. We need a universal EMPI or a universal method of doing MDM. Because if we don't have that, we as an industry cannot get the data to a high enough quality to be used. And there are profound implications for either releasing the wrong data to the wrong person or combining data between 2 people together incorrectly. And we'll probably talk about those consequences on this panel. But the solution to that has to be that we overcome the policy barriers that prevent us from having a national viewpoint on personal identity. And then the 3B is simply the patchwork nature of privacy law in the United States. When you look at the federal, state, local, and especially tribal jurisdictions and the ways they have a myriad of laws, we're either going to need rationalization, which probably isn't practical, or at least a more global compilation, understanding of what these laws are and what requirements they place on people. So those are the 3 areas that I really feel like we have to focus on as an industry.
Excellent. Thank you, Jay. Look forward to discussing some of those issues, particularly harmonization. Diane.
Yep. Thank you. Thank you for inviting me. I'm so glad to be here on the panel. As you mentioned, the Confidentiality Coalition is a very broad coalition of healthcare organizations. I'm going to be speaking in personal capacity today, but I do believe I will be representing what the priorities are of the vast majority of the members. It's from healthcare providers to health plans, pharmaceutical manufacturers, pharmacies, PBMs. And I think the key concern for healthcare organizations is to be viewed by consumers as good stewards of their data. Consumer trust is critical. In order for healthcare providers and health plans to obtain information, to be able to provide care and coordinate care and pay for care, consumers have to trust the system. I think we've seen that certainly recently with the contact tracing. If consumers don't buy into it or trust it, you're not going to be as effective as you can. And so what goes together with trust is the idea and the notion that the information will be used appropriately and it will be protected. And so that leads to really what I'd say currently what a primary concern is, and it was alluded to by Jay, is that once data moves from HIPAA-covered entities to non-HIPAA covered entities, as a result of interoperability, which certainly healthcare organizations strongly support. The concern is that many times consumers do not understand that their data, in the US at least, is moving from a regulated, protected space to an unprotected or unregulated space. And so critical to maintain that trust is to develop a national regulatory framework to protect and regulate that data. As a result of that, the second priority would be to make sure that that framework does harmonize with HIPAA. I know we spoke about modernizing healthcare law. Certainly, there are ways that HIPAA can be modernized, and there are proposed regulations in the work in that regard. But the framework that we believe should be established for data that flows outside of HIPAA should, at a minimum, harmonize, align with, be able to integrate so that there are not unintended consequences as a result of that data flow going from the one regime to the other. We've seen things like that with substance use disorder information, where different regulatory regimes have had the unintended consequence of that data not being accessible as it should for the provision of care, and that's been very detrimental. And then the third thing I'd say, and this really echoes what the previous speaker just said, is that once you have a federal law that is robust and strong, you really then do need to look at making that a national standard, because having different data laws regarding breaches or protections or definitions of data as you move from state to state as an individual goes is not really consistent with the way data moves today, and is confusing for consumers and a huge compliance challenge. So I'd say that is the third critical priority that I think certainly the health industry sees.
Thank you, Diana. It's interesting you use the word unregulated space. We talk about lightly regulated, but we can get into that a little bit as well. Renee.
Yeah, thanks, Jeff. So it's clear that consumer technology has evolved significantly since the first iterations of the privacy and security laws and regulations. Memory serves, the privacy regulations were finalized in 2003, security regulations in 2005. But if you think back, the iPhone did not come on the market until 2007. Consumers now expect to be able to use their smartphones and other devices to readily access sensitive information, including information regarding health. And as consumer and patient preferences and comfort increase, so will technology. Technology will evolve. The products and services are also going to evolve. And the market has already responded. There are incredible innovative technologies that continue to transform healthcare and the ways healthcare providers and patients use data to improve things such as care coordination, diagnostic accuracy, and the quality of care. It's also now possible to develop sophisticated tools to research health and wellness on an aggregated basis, which could result in better and quicker diagnosis and treatment for certain diseases and conditions. But all of this depends on the collection, use, and sharing of consumer data. Ultimately, we believe that the consumer should be at the center of care coordination efforts, The recent rules from ONC and CMS confirm that. But we don't believe the health sector's kept pace with these changes. Sometimes this is because of really significant valid issues with HIPAA. But more often than not, we're finding it's because of misunderstandings and misconceptions regarding HIPAA and other laws. And so you have a result where you've got critical data that is siloed, never shared, thereby making it difficult to share information between healthcare providers, apps, caregivers, family members. So as a result, we at the Consumer Technology Association believe that collaboration among the healthcare sector, tech sector, consumers, and government regulators can drive better patient care. That said, we obviously recognize the increased privacy and security threats targeting the health sector, as well as patients' real concerns regarding the privacy and security of their health information. So it is clear that some of our existing privacy laws need to be updated to reflect the modern reality. So first, we believe that HIPAA must be updated. We at the Consumer Technology Association raised a number of issues in response to the RFI that HHS, the Department of Health and Human Services, released in 2019. Among other things, we recommended looking at how we define protected health information, fleshing out who qualifies as a business associate, and revising the definition of treatment to include care coordination involving software apps. Those are a few of the examples of the recommendations we made. Second, and this could not have been anticipated in the early part of the centuries, there are many organizations that are not covered by HIPAA that store, use, disseminate personal health information. It is a gray area that must be fixed. Many in the tech sector understand this, and contrary to popular opinion, we would actually like a standard that we could follow. In the interim, without a federal comprehensive privacy legislation, the industry has developed its own standards. Last year, for example, our organization published some guiding principles regarding the privacy of health information. Which brings me to the next point, which is we believe that it's in the best interest of the healthcare provider community, the tech sector, and consumers to have one flexible, comprehensive federal privacy law that preempts conflicting state law, that protects consumers, but also allows the appropriate collection and sharing of information critical to consumers' health and well-being.
Thank you. And I think we have like some of those amazing moments in Washington, D.C. where actually, so at least so far, are all agreeing on one thing. And that seems to be some sense of preemption. So we'll see if that continues. Sarah.
Thank you, Jeff. And I just want to thank all of the other panelists for joining us today to discuss how we can work together to help modernize health data privacy law. I'm honored to be on this panel with you. You're some of the best thought leaders in the health privacy space. And I'm also excited to be here to share SIA's views and our new engagement in this policy sphere. As Jeff noted at the outset of this session, we have just launched a health data policy initiative to encourage the modernization of health data privacy regulation. In our view, this includes both updates to HIPAA and the enactment of a national standard for health data privacy for any data that is not regulated by HIPAA directly. We believe that that health data privacy standards must be modernized to meet 21st century realities to ensure robust privacy protections and to enable the safe flow of data to foster the best healthcare outcomes. Because not all health data is the same, this is going to require a dual approach. Think of it as HIPAA and beyond. Nevertheless, like the other panelists here today, we believe that harmonization wherever possible is going to be key to maximizing the potential of health data while serving the needs of all stakeholders, from consumers to industry to researchers. From a high-level perspective, we see several key priorities for modernizing health data privacy. The first applies a little bit more to data privacy generally as well. We need to stop reacting to data privacy concerns based on what is going on in the most recent headlines. We need a national privacy law, and we needed to address national health data privacy standards for individually identifying health information that falls outside of HIPAA. When COVID-19 hit, we were at a disadvantage for how to combat it while safeguarding health data privacy because we don't have a comprehensive national standard for health privacy. And that standard is going to be necessary to set the balance between innovation, including innovative responses to something like a public health crisis, and data privacy. Second, we need more thought leadership from all stakeholders on how a national health data privacy law can do better than the notice and consent framework we have grown used to falling back on. If you've been following the U.S. privacy debate generally, or the remarks that we've heard today during other panels, you have been hearing over and over that notice and consent frameworks overburden consumers with responsibility for vast and complex data privacy choices, rather than allocating the burden onto industry to responsibly safeguard and use the data. We need to identify how privacy law and health data privacy law specifically can balance transparency, greater individual control, the ability to innovate, and the necessary guardrails to prevent harm. And third, with the upcoming expectations for greater interoperability and greater access and control by patients over their data, we have to grapple with how to address health data privacy issues across the ecosystem, which includes the healthcare sector, academic and research institutions, and the general commercial sphere. This is going to require a careful balancing and alignment of privacy values in order to harmonize standards in a way that is achievable and that promotes the potential for health data while protecting individual privacy. In the HIPAA context, Jay's comments on authorization, authenticity, and simplification will be key for a better foot forward with respect to interoperability and being able to extract the potential of health data for better healthcare outcomes while ensuring we have robust and appropriate consumer protections in place or patient protections in place. With that, I'm going to turn it back to Jeff. Thank you so much.
Mm-hmm. Thanks, Sarah. There's a lot to work from there. And let's see, Jason, your opening comments, please.
Hi, and thanks very much for having me. I really appreciate it. And unlike all of the other esteemed people on the panel, I certainly know the least about health data and its different systems, although that may be apparent in a few minutes. But what I am interested in is how we think about ethics and our ethical responsibility in a post-industrial society. And so I think that a lot of those concerns certainly press on the questions that you all are asking about how to think about privacy and its responsibilities today, especially given the complexity of what some have called shadow health records and those types of things. So I think the three issues that I would like to spotlight are the what, the who, and the why. Now, the what, by that I mean the data, the systems that house it and transport it, and that's a lot of what we see in the literature as a really sort of laser focus on what counts as health data and how systems should be designed to protect it and those types of things, and that's absolutely critically important. From a sociological perspective, I'm more interested in the who and the why. So if we strip ethics down to its just essence, ethics is really about what do we owe the other, and we often think about answering those questions in terms of a sort of fixed concept of who someone is. So the other is really often taken as a given in those kinds of questions. But if we look historically, the notion of the self and how we think of ourselves and our individuality has been something that's changed paradigmatically over the centuries. And I think what we're witnessing, as much as an evolution in actual technology, is a social evolution in how we think about who we are. And if that's changing, then we also have to readdress that ethics question. What do we owe the other from the standpoint of who is this other in the contemporary society? And so we have to raise questions about how people think of themselves, how they think of their personal and private space, something that's changed dramatically even in just the post-war era, and is continuing to change in the digital age, even at an even faster pace. So I'm interested in questions like that, and I think that those really have to be answered when we talk about privacy, because most of what I see really sort of programs notions of privacy around a post-war concept of ethics and rights that I'm not sure is fully responsive to the notion of self in a post-industrial society. And so I think that those are important questions. And then I see somewhat less critical reflection, although there's obviously concern about it, but a little less critical reflection on the why. And by the why, I mean the risks of privacy breaches. So certainly the risks of privacy breaches are significant, but we often don't think critically about how to manage those risks in a sort of as a broader social project. So for example, when it comes to privacy breaches with respect to data, there are some risks that are associated that are manageable and some risks that maybe are more difficult to manage. If, for example, a privacy breach discloses someone's disease status, particularly with respect to a stigmatized disease, take HIV/AIDS, perhaps even COVID, that may be difficult to manage because that stigma is so sort of diffused in society. But a lot of the concern is around other kinds of risks, like if my disease status is disclosed, will it affect my health insurance and my healthcare access? And those are risks that can be approached from a number of different angles, which I think calls us to think more broadly about our collective social responsibilities as these data capacities sort of evolve. So, for example, another way to approach that issue is to raise questions about why our insurance or why our healthcare access is tied to to employers in the first place, and why disclosure of a disease puts us at risk for losing healthcare. This is of course takes it out of just the space of data privacy and information management and places it where I think it is most appropriately addressed, which is in the broad social sector as a collective project of our society. So I would say that those are the three: the what, the who.
Thank you.
Why.
It's the concept of viewing this through the lens of the broader social issues, and it's not just a technology issue, it's an ethical issue, it's a social responsibility issue, it's a healthcare policy issue, is both exhilarating and absolutely terrifying. But I want to start with sort of the point of the moment, and Sarah raised this a little bit. We live in this largely unprecedented environment of the pandemic, and I guess the question is, how has the domestic and global response to COVID influenced these policy debates around health data generally and health data privacy specifically? What have we learned from the pandemic that may guide us as we move forward in policy development? I guess I'll start with Renee.
Yeah, that's a great question. I think COVID has really magnified and accelerated a lot of different kinds of issues. I think what the pandemic has shown us is that tension between the importance of data mobility, the importance of data tracking, all the uses of data on the one hand, and patient and consumer privacy on the other. And I think for me, what this really calls into question is whether or not we are going to continue in this sort of amorphous, gray, unclear area. So as I said in my initial remarks, there are a lot of organizations and stakeholders who use, store, and disseminate personal health information that are not covered by HIPAA. And there's a huge gray area as to how those organizations are to handle the data they use, store, and disseminate. And that's one question. So to me, I think the ultimate issue here is a federal comprehensive law that is flexible, that balances the issues that I talked about. Standardization for innovation is one of our mottos. And without those standards, you have organizations, trade associations, other groups, all taking different approaches to the issue. And so I think that's what this pandemic has really brought to light.
We'll get to tension between if we need if we can incorporate these issues, these principles, these concerns into a comprehensive privacy law, if we need something separate. But I do want to continue with this question about COVID. Nancy, what have we learned from the pandemic that may help guide the development, whether it's a comprehensive privacy law or something that's more specifically focused on health data?
I'm sorry, Jeff, did you mean Diane?
I'm sorry, Diane, I apologize. I was looking at the wrong note. My apologies. The challenge of doing this thing remotely.
Well, no problem. I think that, what Renee has said is very true. And the example I gave was with respect to contact tracing apps, but that is just one example where there is wonderful technology out there, and that is just one. Artificial intelligence is others, and machine learning. And the critical concerns are, are you going to be able to use this technology in a way that is effective and is going to be beneficial to society? And if so, you're going to have to provide a privacy framework that individuals feel comfortable sharing that data for those purposes and understand and know that their data will not be used for other purposes or will not be exploited, and that it will be protected from things like breaches or misuse or those types of things. And so I think right now the US is unfortunately somewhat of an outlier in that regard because it does not have that framework, and that is raising concerns, not only about the transfer of data internationally between the US and elsewhere, but it is raising concerns about the effective use of technology, because unless consumers buy into and understand and accept that their data will be protected, they're not going to share it. They're not going to want to share it. They're either not going to opt in or they're going to opt out. And so the critical requirement is to put in place protections that will allow the data to be used for the purposes in which it's now currently being, unfortunately not collected. You're having, huge technology companies offering contact tracing apps and other mechanisms to help deal with the pandemic, and they are less effective than they could be.
Jason, and touch on some of the ethical issues around here as you look through this ethical framework. What have you learned? What have you learned from COVID that may help guide policy development for health data?
Well, I mean, just to draw in the thought about the changing notion of the self. I mean, I think COVID has really shown this to us. Post-war, in the height of modernity, who we were, how we thought of ourselves, very tied to large-scale social structures, religious affiliations, what we produced. So a lot of manufacturing. These were sources of identity for people. And that's really been shattered in the post-industrial era, where we now draw sources of identity much more from consumption. And what this has meant is that we've become a much more individuated and sort of fractured, in some ways, society, whereby individuals are constructing their social identities in a much more fluid consumer marketplace than ever before in history. And what COVID shows, and COVID is an excellent example of this. I mean, how people respond to the risks of COVID double as political and social statements, right? Whether one wears a mask, whether one believes the science or thinks it's a conspiracy, these are identity constructs that reflect how someone thinks about themselves. And so that I think that what COVID really lays bare is the context in which we've got to think about ethics. And it's a very complex system, because who is the other? It's now a very fractured construct, right? That we have to try to. It's what Zygmunt Bauman referred to as we're in a period of liquid modernity, meaning everything is fluid and diffuse, and it's like trying to put your thumb on a drop of water, and it just scatters. And that's the person we're trying to think of ethics for.
So again, terrifying and exciting at the same time. I think all the panelists referenced the need for a national standard and a national privacy law. Jay, is there a way to align HIPAA privacy standards in a federal data privacy law with respect to health data? If so, you talked a little bit about some of the principles, but can you just clarify where you see the potential for alignment, and can it be done?
Well, let me start by saying that I feel like we as an industry have greatly misinterpreted HIPAA. HIPAA, as originally written, basically said three things. It said, number one, a member owns their own data. It said, number two, all you covered entities out there, it's your job to protect the data. And then it said, number three, but we fully expect the data to freely flow among these 5 use cases. And the payment of healthcare is one, and the treatment of healthcare is one. I am fully aligned with the concerns people here are saying about things like a contract tracing and risks to privacy. But at the same time, if we'd had interoperability at the beginning of 2020, as the government had originally intended in its proposed rule, our ability to respond to HIPAA would have been entirely different, and I believe entirely better. It would have been easier to use effectively telehealth. We would have had better ability to understand much earlier what the comorbidity effects were on mortality and stuff. So there's a balance here. It's a balance that was built into HIPAA. It's a balance that has to be built into any privacy law. On the one hand, we have to protect people's privacy for all the trust reasons that I think Diane so well expressed. On the other hand, we have to allow people to own their own data. We have to allow people to use their data and to make choices about how their data is going to work. So I actually believe we are light years away from a federal law that will answer the problem of all the regional laws, state level, tribal laws we have about privacy. I think we're likely to see some federal legislation on privacy, but I think it'll do what the SHIELD Act in New York and the CCPA do in California, and that is it'll create carve-outs around HIPAA-regulated data. Well, in California, if you're a physician, your healthcare side is not regulated by CCPA, but you as an individual are. And so this goes back to the point that I think Renee was making. You know, most entities in healthcare IT simply want a standard to follow. The problem is figuring out the complexity of it. But I see a lot of political barriers and policy barriers to getting to a law that is not only national in nature, but comprehensive enough in scope that it eliminates the fracture. What I hope we can get to first is to solve this problem around identity. Because again, if we can't prove that the Jay Sultan who lives at my address is the same Jay Sultan in these 4 different databases of data we want to combine, we as an industry, then we're going to make mistakes, either of over mingling the data or under mingling the data, both of which have tremendous repercussions from a healthcare quality, preventing accidents, making sure diagnoses are right kind of basis. I guess what I'd say in summary to your question is this. What CMS has said as part of this debate, I truly believe. We allow people to buy cars. We allow people to buy houses. We allow them to parent children. We let people choose banks. We allow people to make choices, all of which have profound impacts on their lives. And yet we do so because we recognize that's the society we live in. That's what we as individuals believe we should be able to control in terms of our data. The laws all say, again, that a patient owns their own data. But I ask any of you, which of you feel like you actually own your data? Which of you, if you were to get sick, could use access to your healthcare data to improve the quality of your care, to make decisions about your healthcare? So this is why I wonder about, as valuable as a national law would be, and I would love to see one that's effective, that could really answer the questions. I think we're probably condemned to live in a world of multi-jurisdictional confusion, despite kind of universal calls saying we need to clean this up. And so I think we need to look at how we make incremental improvement. And so that is, how do we get to an identifier that we're all comfortable with? How do we create clarity around how contract tracing data can be used during a public health emergency, as opposed to how that data wouldn't be used when there's not a public health emergency?
So it seems like there's a tension here between this concept of consumers and healthcare consumers owning their data, being able to comprehend how it's going to be used, and some of these benefits that Jay referenced, and continued innovation. So as you look at the development of whether it's a comprehensive federal privacy law or specifically health data law, how do you address that tension?
The emerging consensus on how to address that attention is through individual rights of access and control, correction, and in some cases, deletion of data. That's what we have seen in the various federal proposals for comprehensive privacy legislation. It's what we've seen in California and what we see in GDPR. And so that's a start for what that could or should look like. The concept of health data ownership can be quite controversial in some circumstances, because it can raise issues of there being a price tag on privacy, and that it's something that only a certain subset of the population perhaps can afford, whereas others, through the ownership of their data, may give access to that data in exchange for free services, and others could pay for the same services. And I think when you're in the health data context, the concept of ownership becomes even more sensitive from the perspective of individuals are trying to make extraordinarily difficult choices about their personal wellness and their own healthcare, and they need access to their data in order to do that. And if you can have a notion of access without that concept of ownership, if there's a way to maintain that balance, I think it's important to do so, because of some of the negative policy outcomes that you could see from a straight ownership perspective. But in the meantime, I think what we're looking at is how do you give patients and individual consumers the right to access, correct, delete data in certain circumstances, and then of course data portability rights, the ability to take their data where they need to take it. And that's even more critical in the health data context than when you're looking perhaps at general consumer data issues and perhaps a preference to switch from one provider to another for social networking.
And Sarah raised this issue of consumer control and specifically notice and consent. Should we consider moving away from this this notice and consent model? Is there a better system? This is for Diane. I'm sorry.
Oh, sorry.
Unless you want to find.
I agree with that concern. Currently under HIPAA, there is not really the notice and consent. It's more of an issue of notice transparency, and then what are your reasonable expectations that the data will be used for in the context in which it's given. And I do think a model of that nature is probably the better way to go for the reasons that Sarah stated. I think the notice and consent model has become a form of rubber stamp. It gives the illusion of control to consumers, but they really are just providing blanket consents, and it's overwhelming, and you really don't have the time to go through the reams of information that are included in those consents, and it could include a vast array of consents that go way beyond what one would reasonably anticipate. So I think much more important is to have clear, concise, plain language notices explaining these are our data practices, these are your data rights, and then guardrails that the data only be used for purposes that are reasonably closely related to those purposes. And if you want to stray beyond that, then you would need to get, express consent of the consumer, and then guardrails around that there are certain prohibitions, like in the HIPAA, using genetic information for underwriting or using certain attributes of information for discriminatory purposes are just totally off limit. And I also just second Sarah's points about ownership. I think I agree with Jay. The point is trying to make individuals should control, access to the data, have a right to it. But I think the concept of ownership does bring in other concerns, and that it, maybe a better way to approach it is really, giving individuals rights with respect to their data, and then giving other entities permission to use the data for certain purposes consistent with the reasons it was provided to them.
Renee, you CTA, go ahead, please. Jump in. Renee, was that you? Did you want to say something? Did you want to respond? No? All right, well, I have a question for you, so it's good. So CTA represents hundreds, thousands of technology providers, many of whom are healthcare companies, who are innovating quickly. So this sense of sort of informing consent and bringing consumers along ownership of data, how do you construct that in a way that doesn't prohibit continued innovation and providing sort of these great outcomes and better healthcare outcomes?
Yeah, it's a tension, and yes, we represent quite a few people in the tech sector, and I don't think you'd be surprised to know that there is some disagreement about that within the tech sector, right? Depending on the kind of information and the kind of services you're providing. So it's something that we're continually wrestling with, but we have not really come up with a consensus way going forward, and that's one of the issues that I brought up in terms of standards and the ability for technology company and other stakeholders to have a plan of action and a plan to follow. While we are experts in a lot of things, I think we actually need some direction from other folks, and we'll gladly follow.
I wonder if I could add one point to that. I think that there's in the 21st Century Cures Act, in the interoperability rule, we have a mandate around. We have a mandate today around Smart on Fire, as a means to say when you as an individual want to initiate the movement of your data, you provide, the rule says consent. I'll call it authorization for that data to move, and your data doesn't move, at least under the interoperability part of the rule, absent that individual initiating the action. that feels like where we're going as an industry. The challenge with it is this, and it goes right to what I think Diane was talking about. You're going to have 1,000 apps out there, each one of which is going to have its own EULA language. So what we're going to do is we're going to create a stream of non-HIPAA regulated, FDA or Office of Civil Rights regulated, PHI, each stream of which will be tied to the privacy limitations and the consent guidelines that were in the EULA for that particular app vendor when that data came out. And we're going to see a remarkable variance of what kind of rights people gave up, to Hannah's point, really without understanding what they were giving up. So the rule does create some responsibility on the part of payers to educate patients about this. I feel like the idea of educating and empowering people so that one who says, hey, I would be glad to exchange this data for something of value, and another person would say, I don't want my employer finding out my HIV status, I never want to share this data, is something that people could meaningfully understand and apply their own rules in the context of all these different EULA terms that people won't understand and comprehend. So getting better standardization, I want to call out some of the work that Karen's done around creating a voluntary code of conduct in this area. I think those are the kinds of ways that we as an industry come out of this until we get unifying legislation from the government.
Thank you so much. This has gone by so fast. We're actually almost at the end of our session, so I'm going to close with one final question, and I'll give you a choice. So you can either answer, give the odds that the next Congress will pass a comprehensive federal privacy law, or specifically something more focused on health data, or as Congress begins to look at these issues. We talked earlier about sort of three principles, but what is the one thing that must be included, that absolutely must be included in the approach? So let's see, I'm going to start with Jason.
So I think I'll answer the second and maybe build in a bit of an answer about the question of consent. I don't think we want to jettison the notion of consent, but what we have to build into any forward-looking legislation or even practices around data privacy is a realistic understanding of who we are and where we're at. And the idea of consent is often modeled around a highly rational, highly informed consumer making rational choices about rational and knowledgeable choices about their data. And not only was this probably never really the case, because few of us are fully rational actors in any context, let alone the marketplace, but this stuff has become so much more complex that, number one, we're not really capable of rational choice within the marketplace. AI is a great example where it grows so fast that we either don't know it or what it's doing, or can't really know what it's doing because it's all behind the scenes. But also to recognize that we're not all rational actors in the marketplace, and that we're not all positioned equally to exercise informed control over our data, and that can create and exacerbate disparities. So that's just as an example, the kinds of realities I think we need to build into how we approach questions of consent and privacy.
Okay, thank you very much. I'll go to Jay quickly. Timeline for Congress, or the one thing that must be included in the privacy law.
I think it's likely we'll see a bill in the next 2 years, but it won't solve the problem. It'll just add to it. That's my prediction, and I'll stop with that.
Thank you. Let's see, Diane.
Well, I'll be the eternal optimist. I say it every year, but I do believe momentum is building for a national federal data protection law. I don't think specific to healthcare, but to health data, to personal data linked to individual. I think there are a lot of forces going in that direction, putting aside politics, which could always gum it up. And much harder question to say the one thing it must have. I can think of a lot of things it must have. I mean, at a minimum, it must have robust security protections, and then I think data consistent with the use of data consistent with the consumer's expectations, an understanding of a custodianship, that you're holding data on behalf of someone else, which gets more to the ethical questions.
Excellent, thank you. We go to Renee and then Sarah.
Yeah, I agree with Jay completely. The one thing, any future law really has to tackle the issue of state preemption. The patchwork has to be clarified, has to be cleaned up, and we need a clear sense of direction and standards that people can follow, people and organizations can follow.
Hear, hear. And Sarah?
I'm going to be an internal optimist on a law in the next Congress, and then on what it needs to include. It's going to have to grapple with how to define consumer health information, how you actually strike the right balance in the commercial sphere, rather than as opposed to the how HIPAA does that in the health sector.
Well, thank you, all our panelists. This is clearly the beginning of a very long discussion. We didn't even begin to dive into so many other related issues. So stay tuned. There's more and more to come. Thank you so much to all of you for participating. Thanks to our audience. And we look forward to hopefully continuing this discussion maybe at this forum next year and throughout the year. And we'll see if Congress acts. So thank you all again. Thanks for your time.
Thank you very much for having us. Thank you.